Hypertension or high blood pressure. Probably everyone knows this word and a lot of people suffer from it or have some relative or friends around who have hypertension. Now let's see it a bit in detail how much this monster can be horrible and destroying. Elevated blood pressure affects more than 1 billion people all around the world and causes about 9.4 million deaths every year. Actually, we can easily compare this to a world war casualties. Beside all of this, it significantly increases the risk of too many other fatal diseases. For example, it doubles the risk of cardiovascular diseases like coronary artery disease, congestive heart failure or CHF, stroke, renal disease, and peripheral artery disease. So the real death numbers in a year is far more than what we expect. In severe cases, it can also lead to vision loss or cognitive impairment. This disorder usually begins to appear in adults around age 30 to 40, although sometimes it can start sooner. The peak of incidence is around 50 to 70 years. As soon as the disease is diagnosed, it needs a lifelong management. That is what makes this disease even more horrible, because you need to take care of yourself daily with a delicate plan to reduce any possible and upcoming related disorders, like what we said at first. Fortunately, nowadays, there are too many ways and medications to control it, so that is not a big deal for almost all patients to have their disease under control. It just needs an obedience to the doctor and accuracy in taking the medications. It is really necessary to everyone to know any culprit and parameter that leads someone and throw him in hypertension pit. Unfortunately, some of these risk factors cannot be prevented, and this is another dark side of the hypertension. For example, genetic and aging are two prominent unpreventable factors. But who knows, maybe one day we could even eliminate these factors by genetic modification. There's another dark side of the disease that makes it more dangerous. And what is it? Many people with hypertension don't know they have elevated blood pressure for a while, until it reaches a dangerous point. It can remain silent for even several years and affect multiple organs in the body, then say, "Hi, it's me here." Oh, that's such an unwanted guest. That is why we call it silent killer. There's no obvious level of blood pressure which defines hypertension. But if we consider a systolic blood pressure of 115 and diastolic of 75 as normal, cardiovascular disease risk doubles for every 20 unit increase in systolic and 10 unit increase in diastolic pressure. But one of the newest valid classifications defines hypertension as systolic blood pressure higher than 135 or diastolic higher than 85. About 80 to 95% of hypertensive cases have primary or essential hypertension. And what does it mean? Actually, primary hypertension is a consequence of an interaction between environmental and genetic factors. There is no specific cause for this type. Primary hypertension usually develops gradually over time. At the other side, 5 to 20% of patients have secondary hypertension. This means you can find at least one underlying disorder that causes the elevation of blood pressure. You can see all causes of secondary hypertension in this table. The most common culprit is renal diseases. Other causes, as you see, are renovascular, adrenal misfunction, aortic coarctation, obstructive sleep apnea, and preeclampsia or eclampsia in pregnant women. And even some medications can be the main cause of secondary hypertension, like steroids, tricyclic antidepressant, and even some really useful medications like NSAIDs. It is really important for any hypertensive patient to be assessed by taking complete history and physical examination to confirm the diagnosis, screen for other cardiovascular problems, and also realize if the patient needs any intervention. In this table, as you can see, there are all necessary laboratory tests for initial evaluation of hypertensive patients. renal function tests, endocrine panel tests, checking fasting blood glucose and lipid panel, and other tests to determine if there is any obvious defect in the body. All these tests should be obtained annually, or even more frequently if clinically indicated. Lowering systolic blood pressure by 10 to 12 units and diastolic blood pressure by 5 to 6 units confers relative risk reductions of 35 to 14% for stroke and 12 to 16% for congestive heart failure within 5 years of the initiation of treatment. So, choosing the proper treatment for any individual is vital. In another video, we will gonna explain all treatment options for hypertension. So stay tuned and subscribe to our channel to be notified for other upcoming videos.